Uterine fibroids are the most common type of benign tumors in women. Surprisingly, half of all women have fibroids, but without any associated symptoms, many women don't know they have them. We are very privileged to have the world authority on uterine artery embolization with us today, Dr. James Spies. He is the Chief of Radiology at the Georgetown University School of Medicine and head of the Georgetown Uterine Fibroid Embolization Program. He is also the doctor who performed surgery on me. Hi, and he's my favorite doctor. Dr. Spies, thank you for joining us today. This is a subject that, as an African-American woman, throughout my life, because I've had a fibroid was noted when I had a cyst on my ovary a long time ago, and they saw pea-sized, and I've just had it all my life. And because of you, I got a little bit of a respite from it. But African-American women disproportionately do seem to have fibroids, or so it seemed to me. Now I bump into all kinds of women who tell me. I talked to somebody in your office the other day. They said, yes, he performed surgery on me. She's a white woman. I mean, it's what is going on?
Well, they're very common. And you know, in the old days, people didn't talk so much about it. Your mother's generation, women just got their hysterectomy. The doctor said, you've got fibroids, you've got symptoms, you get the hysterectomy. And that was really, you know, it was a sad thing, but that was really where we were. It is true, though, that African-American women are disproportionately affected. They're 3 to 4 times more likely to develop fibroids that cause symptoms and problems. Fibroids are very common in all populations, though. Maybe half of women will get fibroids by the time they're 50, but a minority of those will need to be treated. About 20% of women overall, though, during the course of their reproductive life, will have fibroids that require treatment. So it's a very common problem. African Americans, Caucasians, Asians, but African Americans particularly.
Any specific age? Because I was young. I was 23 when it was noted that I had a pea-sized fibroid, and then it just, you know.
Well, unfortunately, African American women are more likely to develop fibroids earlier in their reproductive life. They're more likely to develop larger fibroids, larger uteruses as the fibroids enlarge the uterus, and are more likely to require therapy, for example, in their 30s as opposed to their 40s. The most common age, if you take all comers, is about 42 or 43 years old. But for many African American women, they face this problem at age 30, 34, 36. Unfortunately, then it begins to have reproductive implications for that group of patients.
Yeah, absolutely. Initially, doctor, and I will use myself as an example, I had a myomectomy. And what that did is, you know, they cut open my uterus and they took out one was the size of a, you know, a big grapefruit. And I had a bunch of them and they got them out. And my doctor said, have kids within 2 years because they're going to grow back. 2 years, they grew back. Then I started having problems, which led me to you, because the procedure that you do is revolutionary, quite frankly.